So I think we should start the session now. Ritika, have everyone joined?
Yes, I am helping Mr. Kulwant Singh to join as of now, but you can start the meeting.
Okay. Ritika, have everyone joined?
Yes, I am helping.
Ritika, should we start now?
I think Altamash, you can start.
Yeah, sure. So, hello and good afternoon, all of you. I am Altamash Khan, Program Coordinator with India. I warmly welcome everybody who have joined us today for this very important session of Interfaith Humanitarian Alliance, the participants, and our eminent set of panelists who come from different organizations in Karnataka. We have gathered here to discuss this COVID situation during the last 1.5 years. What an important role faith leaders play in the crisis. What all they have in COVID response, like vaccination drives, psychosocial support, medical supplies, food supplies, etc. Considering all of these things, especially during a crisis, we look generally to our leaders, especially failures of faith. That said, the Humanitarian Alliance has been doing for the last 1.5 years in different states with our leaders, they try to about response and what work they have done, and also to spread messages on COVID appropriate behavior and promotion. And for that, we are doing it in collaboration with UNICEF, World Vision India, WHO, and the ACL Foundation. We are trying to do a dialogue to build community resilience through vaccinations and promotion of COVID-19 appropriate behavior. So, we would like to begin the session with the keynote address from our UNICEF representative, Dr. Salima Bhatia, who is a health specialist at UNICEF Hyderabad office for Andhra Pradesh, Karnataka, and Telangana.
Thank you.
Yeah, welcome. So I would like to briefly introduce about Dr. Salima Bhatia ji. She is a public health professional with over 9 years of experience in Ministry of Health and Government of India. During her tenure, she provided technical and programmatic support for the implementation of the key maternal health programs such as Pradhan Mantri Surakshit Matritva Abhiyan, Lakshya Midwifery Initiative, and the recently launched Surakshit Matritva Ashwasan, that is Suman Initiative. She was also a part of the policy and planning division of the MOHFW and has contributed to the draft National Health Policy and several health system strengthening initiatives. She has been awarded V Forestry Award for exemplary contribution to women's health by Federation of Gynecologists and Obstetricians of India. So I would request Dr. Salima to kindly begin her keynote address.
Thank you, Atmash, and thank you for the very kind introduction and the very kind words. I'm young and I'm younger to most of the people, I believe, over here. And first, I would like to, really thank everyone for joining us today, and also thank you. The very fact that all of you and all of us are together today really points to your commitment and your willingness to actually contribute and do our best in this unprecedented crisis. We are living in a times which none of us had thought. I don't think we've ever predicted. Anybody would have imagined that we would come to a situation like this where we would have to face such a difficult situation, stay at home for so long, not be able to greet each other, not be able to go to religious places. Who would have ever thought that this kind of a time would ever come during our lifetimes? It's like, we earlier used to say we had wars and other things where my, generations before me used to talk about such difficult times. But unfortunately, our generation has also witnessed such a unprecedented time. And given that, I really want to welcome all of you, and I want to reiterate, I'm sure we all know, but I just want to reiterate for your benefit and for the other benefit of others who have joined us today, that your leadership plays a very important role. You are role models for the others, and what you say makes a difference to so many. So as leaders, I believe that, and as role models, I believe that our responsibilities on our shoulders is quite high. I would say that we have two major levels of responsibilities. One is that we handle organizations, or we handle our religious institutions. So when we handle religious institutions, making sure that our religious institution is safe for those who are coming to the institution, and we do not spread COVID, is the very first thing that is our responsibility. And the second thing that I think we need to focus on is, what do we promote when we say, and what do we preach, and what do we speak of with the people who are going to be with us? So I'm going to talk about these two important aspects. What should we as religious, if I was in a position of a religious institution leader, what would I have done? Or what does the world leaders, UNICEF, WHO, Government of India, what do they recommend should be done by leaders such as you? That's the first part. And second part I'm going to talk about a little bit is what you can do more as role models for the communities that you serve. My apologies, I do not speak Kannada, and I'm sure that there would be a lot of people who would be interested to hear a lot of the work that is happening in Kannada, but I'm sure my colleague Manoj will be around. So any questions that people have can also be answered by Manoj. So coming back to the first point that I was talking about, what is it that we need to do as religious institution leaders to support and make sure that our institutions are safe? I think we are all aware that hand hygiene is a very important part of what really needs to go on and what we need to focus on. But what happens generally with hand hygiene is that, people just wash hands just for the sake of it. So what is important when it comes to hand hygiene is the 20-second rule, the whole 20, the hands, washing of hands for 20 seconds with soap and water. That is very, very important to follow. We tend to forget that, and we tend to get very, lapse, because it's difficult to keep washing hands all the time. But I think it's something that we have to do given the current circumstances. The second important point that I want to speak about is masking. We very recently had an incident in Delhi where, unfortunately, religious institutions had to be shut down because COVID appropriate behaviors were not followed. Now, if we want to make sure that our institutions are safe and we do not pass on COVID to those who are coming to us with a lot of faith, then we have to make sure that we have someone who is monitoring the mask behavior of the devotees. I think it's important that, they generally, what happens is people wear a mask just for the sake of wearing the mask. The mask is here, they wear it like this. This doesn't work. Whenever there is, you come close to someone who is anticipated to have COVID, masking is one of the sure shot measures of making sure that you don't catch the infection. It is still not 100%, but it is one of the best. So I would say not only masking, but double masking. The government of India has now recommended double masking, and I really hope that that information percolates down to crowded places, because whenever we are in a crowded place, it's important to wear two masks. If you're not wearing an N95 mask, then it's important to wear two masks together. The second part of it about masking is that we need to focus on is, along with masking, you should make sure that you have that distance between two individuals, social distancing, especially in crowded places. When we go to religious institutions, earlier we had so many people coming together and it was an amazing feeling. But unfortunately now, given the situation, we have to make sure that we have enough volunteers who can ensure social distancing between the crowds and between people who are coming to the institutions. So crowd management is a very important area. Let's try, we could look at something like separate entry and exits for visitors so that there is less crowding. We should also try and see how we can display some of the important COVID related material in our institutions so that people are aware and they are constantly reminded. Say, I don't think anyone here does not know how important masking or social distancing is, but it's a question of making sure that we are reminded every time. The minute we see it, we try and correct ourselves. So it's important that those kind of posters are there, those kind of announcements are there. We have people who are monitoring the behaviors, because this is the need of the hour. What we could also, and now I'm talking more about your role as as a religious leader and as a role model. So one is protecting your institute. And when it comes to protecting your institutes, we've spoken about how we should ensure masking, how we should ensure social distancing, how we should ensure that COVID appropriate behaviors are followed. But you as a role model can do so much more. When you are able to influence people, whatever you say will make such a huge difference to the ones who are listening to you, because they respect you and they obviously are willing to listen to you. That is why they are coming to the institutions. So I think we should try and use that influence to the best, for the betterment of the people. And what could be done is that if we could promote vaccination. We are aware that India has reached heights when it comes to vaccination. It's one of the countries in the world. The world is watching where India's vaccination is going. We have broken world records. We are vaccinating, very similar to one small country every single day. That's a huge trend and effort that the government is putting when it comes to vaccination. So as religious leaders and institutions, how can we promote vaccination? Is there a possibility that we maintain a line list of people who are within our particular sphere, and whether we can whether they have been vaccinated or no? For example, UNICEF maintains a line list of all its staff to make sure that they are vaccinated. So what kind of steps can religious institutions take? I'm sure that you are here today. You have all taken very important steps, and more than me, it's a time for us to listen to you and get newer ideas on how we can implement the COVID COVID-19 vaccination and other behaviors better, and how we can fight this disease better. But I really hope that you can promote vaccination in the best way given this situation. But your role, I think, will go a little bit beyond that, because the support that religious institutions can provide for in terms of helplines, in terms of psychosocial support, in terms of services for women and children, in terms of services for those who have lost their jobs, or who not direct services, but some kind of facilitation. So there are a lot of examples where religious institutions have come forward to support the society in all of these areas. What is also interesting to see is that religious institutions can play a very important role in making sure that there is no wrong information that is circulated. We have the WhatsApp university, I say these days. Everybody has learned something new from the WhatsApp university, but the WhatsApp university, unfortunately, is not always correct. And it is up to the role models and leaders to make sure that the information that is going to the general public is correct. So the role that the institutions can play can really model around the fact that right information is circulated from your official channels to the others. See, UNICEF has been working with the government and with a lot of religious institutions. We have worked with Sri Satya Sai Seva, we have worked with JSS, we have worked with some of the Jamaati members, we have worked with Art of Living and the Archbishop of Bangalore, and a lot of other organizations. We sometimes directly, sometimes through the state government. And it is the government and UNICEF and everyone who've come together to create a set of IEC materials, videos, correct information, that kind of, there is a resource that is available that everyone can reach out to. And if there is anyone here who would like to, touch into this resource, then we have Manoj here, and he'll be more than happy to share everything in local language. What is also important is that if there is any trainings that have to be done, then UNICEF would be happy to take forward these trainings and would be happy to take forward either virtual or on-site trainings as required. So that's largely the thought process that is there. What is also important probably here is that when we share information, we follow the official media channels of the Ministry of Health, of UNICEF, WHO, and we also try and make sure that when some of the practices, very, very, very few practices that may need to be altered within our institutions. For example, when we go to religious institutions, we have, because of our faith, we have the habit of touching photographs, touching the equipment, touching the railings, or, touching the feet of the idols. Now, those are the practices that we will have to probably have a relook at, and make sure that that doesn't become a source of infection for the others. So these are some of the thoughts that I had and what I wanted to bring on the table today. We have standard SOPs for religious places that Government of India has released, and you can reach out to Manoj for further local information. But largely just wanted to highlight these 2-3 points here and say thank you. And once again, appreciating and thanking everyone for joining us today. Thank you. Over to you.
Thank you, Dr. Salima. Now, since most of our panelists have also joined, I'd like to briefly introduce each one of them. We have with us Mr. Suhaib Khan, who is from Islamic Information Center. He is also the president at Islamic Information Center, which is an NGO. He's CEO and principal of the Karachi Public School. He's also the director of Spy Hospital and has worked Dell, Infosys, and Accenture Mr. Khan, through his organization, has provided monetary support to people in need during the pandemic. We have also Mr. Rakesh Baria, who is the president of Sri Gyanodaya Digambar Jain Trust and Temple. Rakesh Baria belongs to the Digambar sect of Jain community and is president of Sri Gyanodaya Digambar Jain Trust, Bangalore, which operates from the Sri Gyanodaya Digambar Jain Temple. By profession, he is the director and partner for a private company in Bangalore for the past 12 years. We have Kiran Kumar, who is from Shivoham Shiva Temple, and he is the chief of temple. We have also His Grace Swam Prakash Das, who is currently serving as Temple Management Council member in ISKCON South, Bengaluru. He is MTech in Structural Engineering from NIT Surathkal. He has also worked as a design engineer of bridges and flyovers for 5 years. He conducts value education classes for children. And we have Dr. Father George Kanathanam, who is the director of both Suman Halli Society and Hope Society. Dr. Father is a Hope Society. His Hope Society, under its flagship initiative, provides food to 300 individuals every day. This is a pan-India initiative. Suman Halli Society, amongst its various initiatives, is also vaccinating disabled people. And also that the session will be in English, Kannada, and Hindi. We have Manu Sebastian from UNICEF, who is SBCC consultant at Karnataka office. He will be facilitating the Kannada interpretation during the question and answer round. So anyone can ask their questions in whatever language they are comfortable with. Now, I would like to ask the moderator of the day, Mrs. Shobha N, to take over from ask her panelist questions. Mrs. Shobha ji, please.
Good evening, ladies and gentlemen. I'm really glad to be here. And for those of you just joining, welcome. And now, without further ado, we will turn the time over to the main topic. We have 2 questions, and our beloved panelists will be answering those questions. If you have any questions during the session, please type them in the inbox, that is question box in your Zoom, so that I'll bring it up during the presentation. And as we informed that there is a separate time for question and answer at the end, so we can bring the question, your questions during that time. So first of all, I'd like to introduce our today's first presenter. One sec. First presenter, Father Dr. George Kanathanam, and the first question will be promoting COVID appropriate behavior and community work with local people and devotees. That is the response. The presenter should elaborate on this. The first question is, please elaborate on the COVID-19 relief activities done by your organization and share some insights. I invite Father George.
Ms. Shobha, Father George has not joined yet. You can take the questions to others. I'm following up with him.
Okay. Let me invite our beloved panelists. Grace Swam Prakash Das. Designation is currently serving as a Temple Management Council member in ISKCON South, Bengaluru. We welcome you, sir. Please keep your response for 2 to 3 minutes. So we are following that time. Please welcome Grace Swayam Prakash Das.
Thank you very much for giving me this opportunity to share some of the things what we did from our end so that it may be helpful for others and get an opportunity to learn from others. Can I get the opportunity to share? Screen share?
Yeah, I have made you the co-host.
Thank you. Om Ajnana Timirandhasya Jnananjana Shalakaya Chakshurunnilitam Yena Tasmai Shri Gurave Namaha. Jai Shri Krishna Chaitanya Prabhu Nityananda Shri Advaita Gadadhara Shivasa Advaita Hare Krishna 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 Hare Hare. So thank you very much for this opportunity. So this was a really challenging time for all of us during the COVID, wherein we had to face different challenges, and it was a new for all of us, and the same way for at our end also. As ISKCON, we also faced a lot of initially the challenges of how to do or how to take it ahead. And that first thing what we did was, as soon as we came to know about the government conditions and all, we immediately put the temple under closure so that the visitors will not come, and because of which the social distancing can be maintained and that way it can be managed, and also the regular sanitization of the temple was also taken into consideration. And our founder of ISKCON, his divinity Srila Prabhupada, in 1972, when once he had come to a temple where he saw the people were, the poor people were trying to grasp each other for little food, he said that at least near our temple, people should not go hungry. And in 1972, the ISKCON food relief program started. And even in Florida, when it was happening in 1975, around the Steve Jobs, the owner of Mac company, he also would come and take it in his one of the program. He mentioned it. So when this COVID started, there was all over India, the food relief became much more increased. The many kitchens new came up, and in India, 77 kitchens were established, and till now, 25 crore plus food distribution was done. And in Karnataka, 12,000 plates per day was distributed. In Bangalore, 7,000 plates, and in South Bangalore temple, it was 1,000 plus day plus plates were being distributed, and it was done under the most hygienic condition, with taking all the preventive measures and trying to give our best. And that way many supporters also came ahead, seeing the present situation. There were people who were ready to give the monetary support, but they needed somebody who can prepare it in a large quantity and take it out. And initially it was little fear for us also to how to go out, but we thought somebody has to take the risk, and we went ahead. And but when we saw the smile in the face when some of them were witnessing, it was really quite satisfying. So that way we did the Food for Life program. And eventually when we are doing this, we realized that one thing is that providing food, and many people were coming up with giving this, supplying the food. But at the same time, we realized there is very much dire need of giving them the support, especially mental wellness workshops we started. Because there is a car principle of life. It says that we should accept the change which is changeable, and that we can change. And some things we cannot change, that we need to accept it. Oh, it is unchangeable. And when you understand that it is unchangeable, then we have to rise above that. So the same way we realize that now the situation, we can change our stay or our way of living, but we cannot change the externals or the COVID. So we have to accept it and rise above it. So we brought many mental wellness workshops, and that we brought from Bhagavad Gita, just like Arjuna was in the situation wherein he has to fight, and he was in so much of dilemma in that how to control his mind and how to respond. That we brought out many lessons from Bhagavad Gita and gave to the people. And across Karnataka, there were more than 6 lakh attendees, especially in Mangalore itself, or Mangalore Center. They did every month 18 days wellness program based on Bhagavad Gita, and more than 5 lakh people attended. In South Bangalore also, many batches we did, almost around 700 to 800 per batch we could give. And when it came, we realized that it is not only that everybody, different category of people needs different inputs. Like for the elders one way and the youngsters were looking for something because they're not able to go out, they have the job and all those things. Then how to cope up with all those things? Then we came up with the bring out the best in you. And many of them, they found out that during this 1 year of COVID, when I interacted with many, they said that many of the talents, inbuilt talents were there, but we could not see to it, or we didn't relate to it. But when this opportunity came, they could find out. And we did a prerana. Prerana means inspiration, giving inspiration and giving them a positive outlook towards the life, finding hope in the hour of crisis, or the power of positive attitude, or perfect question, perfect answer, how to deal with this. Many people were losing their near and dear ones. At that time, they needed support. So we tried to do many programs on that. And on the other hand, we found that the parents were there. They were quite anxious about taking care of the children. Children needs playing. They want to go out and play. But they are kept in the four walls. And the parents also, they were telling that we are trying to give them the support, but we are not able to. They needed some engagement. So how to deal with those things, we tried to help. And then when that came up from the parents, then we thought of having value education programs for the children, learning different qualities from the nature, because that we can see outside and we can relate to it. It becomes easier. And then we did, because children want to learn the stories, we did from the different stories and Ramayana and Mahabharata and all. And also we did summer camp for the children so that they get engaged by different activities. So along with that, we did the Vedi cultural contest, wherein there were children participating from more than 12 countries, more than 175 cities, 22 states of India, and there are more than 3,080 participants participating in more than 6,000 competitions. And later, when the prize distribution was there, many parents spoke and they said it was for almost a month. And they said that this whole month, it was so amazing to see that the children were engaged. They're practicing, rehearsing, and to how to present it better. So that gave a lot of solace and satisfaction. And these are some of the photos of the program. And then when we are doing it, we also realized that one thing is we are doing it in the English and other languages, but also it was needed in the Kannada language, local language. Then we came up with some courses in the Kannada language, and right now we are doing it in 11 languages. And we started this ISKCON Kannada channel, and within a short time, 3,000 plus subscribers are there, and we did different courses in that. So that helped them. So along with that, one thing was mental health, wellness courses. Along with that, we thought we should do something for those who are in the forefront, because they are putting their life at risk and they are going out, and seeing that we tried to do best. There are many people who are ready to help monetarily or by giving some items or something, but it has to reach to the people who are in need. So many of the NGOs came up, and one example was that there was one small Christian community. They were a little financially not so well. And when we came to know, they approached us when we were doing the food relief program, and they asked, is it possible to get? And it was so amazing to see that people giving up all the sectarian things and coming forward to help. And also there was one more person, he was from Islamic background. When we started this, connecting the patients and their families with the medical team, because there are many people that they were not sure whether to get hospitalized or even to get hospitalized, where to get hospitalized, that they were not sure. So we made a COVID task force where volunteers were trying to connect between the affected people and the medical team. And that way it could help in a larger way. And that way it was quite helpful for both the teams. And while doing that, we tried to assist the forefront people like police as well as the hospitals by providing the sanitization materials needed or the food which was needed. So that some of the hospital people, they said that we are doing so much, and many a times it would happen that we are not getting time to take our food. And when we receive this hot food, which you come and give it, it's really quite satisfying. So these words were really giving us inspiration to do more and more. So along with that, there are some things which are beyond our control. In all religion, everyone accepts the prayers. That prayers are beyond our ability, and when we cannot do anything, we take shelter of the Lord in the different names. I may call it as Krishna, somebody may call it as Jesus or Allah or whatever it is. But every religion accepts the chanting of the names. Some chant on the rosary beads, some chant on the names of Allah. So we thought that way to give the support by having World Whole Name Festival. It's across the globe for the world peace and prosperity and to support the people. And also we did 108 crore Hare Krishna mantra chanting, by which at least the people can get relief and praying for their well-being. So these were some of the activities which we did. And recently seeing the contribution of the founder of ISKCON, Srila Prabhupada, this is the 125th year of his birth. So our Prime Minister Modi ji released a coin remembering his contribution to the whole world. And yesterday was the day when that was gifted and it was presented to the Chief Minister of Karnataka, Shriman Basaraj Bommai ji, and also previous Chief Minister, Mr. Yediyurappa, and the Sansad Speaker was also there. So these were few things which we try to do from our end. And I really thank you for giving me this opportunity to share some things what we do. Thank you very much.
Thank you, Guruji. It's nice to hear about the ISKCON and its programs. It's nice to know about the ISKCON food relay program, Anna Suraksha, mental wellness workshop. Yes, of course, during this COVID time, like other things and all, okay, that is accepted. But this mental wellness workshop was very much important because the fear factors matters a lot. Actually, people were like captured with this fear factor. It was there in their mind. So this was a great job, and it's really appreciable, Guruji. Thank you. Thanks a lot for sharing all these things. And it will be an encouraging element for us. And now I like to invite our second panelist, respected Mr. Zoeb Khan, Islamic Information Center. Sir, this time is for you. Over to you, sir.
Thank you so much. Thank you so much, ma'am. A very good afternoon to all the panelists present. And thank you for inviting for this event and helping us sharing the details from the different backgrounds and different people, how they have worked on. Regarding the question that you have shared as of now regarding the COVID-19 and the lockdown activities, as an organization and from the Muslim perspective, from the Muslim community perspective, what we have done, first and foremost thing, what we actually did when the lockdown was announced and we got to know about the COVID pandemic was all the NGOs present formed a team and we made a group of NGOs and we all came under the banner Mercy Mission. And we had about 15 plus NGOs who joined this umbrella. And from this Mercy Mission, we did a lot. And individually as an organization, we have worked. And apart from that, collectively in Bangalore, what we did was we coined Mercy Mission and we did a lot of activities. To name a few, like everybody, yes, ration kits distribution, which was very important because it was a sudden lockdown and especially from the lower section of the society who earns on daily wages was a challenging part for them. And somebody like maids and pushcart vendors who had these challenges, we supplied rations to these families. Then we also provided meals on an everyday basis, be it breakfast, lunch or dinner. Beijing Bites was also part of our team, so they also made those lunch. So we had to coordinate amongst the different kitchens that we had. Like the representative from the ISKCON said, that the kitchens, there were across 78 kitchens that they had made. On the similar grounds, even we had about 25 kitchens across Bengaluru, wherein we made meals and it was distributed. What we also did during this time was we also made this public announcements, encouraging people to stay home and to stay safe, because this is something which was new to people, that they had to stay home, and especially from the lower section of the society, wherein they had challenges of food. So to keep them aware of everything, what's happening, and also to provide them food was a challenging task. We also provided water tankers to the slums, especially because these people couldn't go out to fetch water, and because they are in slums, there was no water connectivity. So we provided water tankers to them. Then we also had some SOS calls on ad hoc calls, wherein people were suddenly stuck in different places because it was a lockdown. For example, truck drivers were stuck. So we got calls from different parts of Karnataka, wherein we had created these teams wherein volunteers went ahead, provided them with food and stay, where we could arrange some local hotels or some masjids, for example, wherein we could provide the rooms for them. Now that the masjids were also locked, it was an opportunity for us to use the space for people to stay there, and we provided foods, and we thank the management of every masjid who cooperated, who understood the situation at this point in time as to what was required. And Rohingya Muslims were part of it, wherein food packs were provided to them. Rack pickers, we had identified slums and rack pickers where they stay, provided food to them as well. Free masks were distributed across Bangalore, especially in the lower section of the society. One other thing which became very important at that point in time was procuring oxygen cylinders and concentrators, because we had a lot of calls coming in because people were dying on the road. There were no hospital beds available. People didn't know what to do. It was the first phase. People didn't know. Everybody were panicking, and there was fear as to what is going to happen. And people were losing their near and dear ones. And they didn't know much as to what had to be done. At that point in time, we procured oxygen cylinders, and we gave that interim support of oxygen till they could find oxygen bed, till they could find hospitals and beds. So that that interim support, which was very important, because many a times I have been coordinating with patient attenders, and many patients have lost their lives on the roads in ambulances, and we are witness to that. We feel sorry for that. But then that is when these oxygen cylinders came into picture. We procured, and at that point in time, the rates were increased, but still we had to fundraise for these cylinders, and we did that. We created this awareness, and also that oxygen cylinders were distributed, and by creating a certain procedure. We also helped people in allocation of the beds, because it was new. People didn't know how to follow the protocol because it was from BBMP, and how to get into the private hospitals. So we helped people with getting the beds. We also created a group called Emergency Response Team, ERT, wherein any case that we used to get, we used to put that group in that WhatsApp, put that case in the WhatsApp group, and Emergency Response Team had government officials in that. We had IAS officers, we had NGO heads, we had volunteers who were working on the field, who were there present at the grassroots level, and cases were posted there, and immediately our volunteers and who were responsible in different parts, whom we had identified as leads, so that they could coordinate. So that team was created, Emergency Response Team, and we used to attend to the patients, irrespective of faith and irrespective of different creed. Like everybody, yes, we also followed the same thing. There was no religion that was looked into. There was no creed that was looked into. It was all. What we also learned from this COVID was humanity survived. We lost humans, but the humanity survived because everybody pitched in at that point in time. Also, what we did was, there was trains that were there going to different parts of India. There we had provided food, snacks, and water bottles as well. And keeping these things in mind, we also had this online webinars, because suddenly people had to stay home and they didn't know what has to be done. And we know that WhatsApp was one of the means of communication. And then there was YouTube, and there was Zoom that people were using. So what we did was, we organized webinars wherein we were making people aware of how to use their time during this point in time, and also creating this online sessions, online Islamic classes, technical programs, online sessions for the children, so that within the four walls of their houses, how can they use their time how they can benefit the society staying at their home, utilizing their skills. This awareness was also created. Then what we also did was paying rents for those people, especially from the lower section of the society, because they have lost their income because they earn on daily wages. So providing rents for them, making house advances, because because they were not paying the rents, the owners used to cut their rents in their house advances. So setting up petty businesses like push carts and all that, those financial assistance were done. We also did this. Ambulances were arranged at that point in time because there was a shortage of ambulances during the first wave and the second wave as well. Then COVID burials were done. COVID burials in which, again, irrespective of faith, we have helped people in burials. So suddenly it was a different type of burial because the volunteers had to wear the PPE kits and they had to lower down the graves, get 6 feet or 7 feet inside. And we had to get the JCBs in because there was a surge of death suddenly that has happened. And who would do the bathing and shrouding the dead body? Since that was not permissible from the government, there were certain protocols that we had to follow. And there were relatives who were afraid to come near these dead bodies. So our volunteers and myself were part of this COVID burial team as well, wherein different faiths also we have made the Christian community or the Hindu community. According to their rituals and whatever best we could do, we have helped with the COVID burials. And last but not the least, what we also did was the volunteers and the police personnel who were present at different junctions in different parts of Bangalore, we provided food and water bottles as well. These are some of the activities that we could list that we have done during COVID-19. There is more, and as a community, we stood for that. And anybody who was available at that point in time have done their best, and it was proof that humanity exists, and everybody pitched in, and that was a great part of what we could do during this COVID-19. Thank you so much for giving an opportunity.
Thank you, sir. Thanks a lot. Yes, of course, rightly said, humanity survived, isn't it? It was a great thing to know your good deeds that you have done to the society, and it's really acknowledgeable and it's really appreciable. Thanks a lot for your good deeds. And now we have our beloved father, Mrs. And I just want to invite him. Welcome you, Father George Kanathanam. The question is, please elaborate on the COVID-19 relief activities done by your organization and share some insights. Please be mindful of time. Give your response within 3 to 4 minutes. We are running beyond the time. Thank you, Father. Over to you.
Thank you, Ms. Shobha and others on the panel, and distinguished people who are part of this program. I would like to appreciate this initiative taken to share the various things that we have been part of and doing. Many of the things what we have done probably are common, and so I don't want to go into all the activities. Maybe I just share with you 2 things that may be different from what others have done. Number one was that we set up a facility for people to get the medical consultation. So we had a team of about 30 doctors who were listed, and we had this facility available in about 20 languages from across the world. So people from anywhere across the world, in all the world languages, they could just call up and then get the consultation. So this was one facility that we set up, and so a lot of people were able to make use of the medical consultation that we made available. The second thing what we did after having distributed many relief kits, we thought the families need a sustained support. So we thought we should look at how we can support these families, not just by giving a one-time kit, but by a sustained support for at least for about 6 months to 1 year. Therefore, we started a program called Mother's Meal. mother's meal. I mean, we know that every mother would like her children to be fed. In fact, I lost my mother to COVID in last June. And so in her memory, I started this program called as Mother's Meal. So we started with feeding 5 families, and then we said for at least 6 months, we will continuously support them with a 500 rupee worth of provisions every month, because they need a sustained support. We started with 5 families, but now on the 15th of August, we launched it nationally, and about 1,000 families from every state in the country, we linked up with the grassroots level organizations, and then we had this launch across the country in every state. Then we also moved on to other countries. We moved to Nepal. We started this program in Macau in China. We also started in Ethiopia, Uganda, and South Sudan. So in 6 countries, we are reaching this program, and we are able to support about 3,000 families every month. And we have 4 categories of people covered under this. These are families with widows, families with people with disabilities, families with people with a terminal illness, and also the old people who are living alone. So for these special categories of people, this program was made available, and we are covering about 3,000 families as of now. So from the July of last year, we started this, and we are sustaining this program even now. And the concept is family to family support. We said, well, there are families who are struggling. 10% of probably the population is without food, but 50% of families in the society are still okay. So we were trying to motivate this 50% of families, telling them, take care of one more family. So family to family support was a concept we floated. And so a lot of people joined this program as donors, and we linked one family with the other. But of course, the contributions come to us, and through the grassroots agencies, we implemented this. So this sustained support, we have found that a lot of families, after 6 months, they said, we got job and we are okay to manage now. Some of them needed for 1 year. And so we provided for 1 year. And then we make a reassessment and we take new families. So this being a good concept, now many organizations are adopting this program. And we are, in fact, having an invitation from Sri Lanka to start this program. Probably the next month, we will be starting off also in Sri Lanka. So these are 2 special initiatives taken by the Hope organization. I'm the founder and director of the Hope Society, which we work for de-addiction. We have 2 HIV care centers, one in Bangalore and one in Belgaum. We have a de-addiction facility in Belgaum, and we run this program called Project Vision, which is a global movement on eye donations. And wherever there are disasters, we get involved. We have a project in Nepal for the Nepal earthquake. And we are working in Kerala after the floods there. And when Corona started, we began this program called Corona Care Bangalore. So these are the activities what we have done under the Hope Society. Thank you very much.
Thank you so much, Father. And first of all, we are sorry to know that you lost your mom. Sorry for the loss, and our condolences to you and the bereaved family. Yes, no, it's really glad to know about this family to family support concept. This is like for the first time I'm hearing. So it's a nice concept, and thank you for all the good deeds that you are doing for the society through your Hope Society. Thank you for that. Thanks a lot for participating. And now I would like to invite our 4th panelist, Guru Rakesh Breya, President Shri Jnanoday Digambar Jain Trust and Temple. Welcome you, sir.
Thank you very much, Sobaji. My name is Rakesh Breya, and I belong to the Digambar Jain community of India. And my welcome to you with my saying of Jai Jain to all of you. See, as we have seen during the panel discussion so far, that during the COVID pandemic situations for the last 1.5 years, almost 2 times very bad situation has happened, and people suffered a lot. There were many families who lost their near and dears, and there were, chaos all around the places due to the unprecedented lockdown also. So, every community came forward, every person who was thinking that people are suffering due to health issues, due to food issue not available. There were a lot of such things happening around. We also thought of doing many things. I represent a trust called Sri Gyanodaya Digambar Jain Trust, which is a charitable trust. And that trust was basically involved in charitable activities. And we were also tying up with one more trust called Sri Shanti Sagar Foundation. So we were basically coordinating many things along with many other trusts all over India, particularly in Bangalore and Karnataka areas. So the foremost thing which we do, we did during that time is the distribution of food and ration kits to the needy people all over Bangalore, or certain places in Karnataka wherever our people were present and where we could send our monetary help. So first of the thing which we started is that we put up the money from our trust side, and then we collected money from our community people, and then we started utilizing the big kitchen which we had in our one big Kalyan Mandapa called Karnataka Jain Bhavan in Basmangudi area. And there we started making around 2,000 to 3,000 food packets every time. That means around lunchtime or dinner time. So we were distributing that, and we divided the entire Bangalore population in around 5 to 6 zones, which were connected to each and every temple which we had in those areas. And there we were taking the help of the local volunteers, and then we were mostly concentrating in the slum areas and those areas where people were finding it difficult to have the food as well as other facility. Along with the food, we were also distributing the ration kits, which were having dal, oil, atta, and rice kind of things. Along with that, we were also distributing certain preventive medicines, for people to take care, which nobody was knowing, particularly during the first wave of the pandemic. Nobody was knowing what to do and how to do. So we were just giving some medicines which were coming in handy for people to take, and then make them aware about what could be the repercussions of getting caught with this kind of virus which was there. Of course, minor things like distribution of masks and all that, and making the people aware about what they have to do during this pandemic time. But these were the situations where people were not really used to these kind of situations. So making them aware was the first most priority. And for doing that, we had to prepare a lot of training materials, including pamphlets, including videos, including some localized WhatsApp groups, so that we can send the information to them what to do, what not to do, and how to take care of their families and all that. During the second pandemic wave, there were a lot of further issues which came up, particularly with respect to the oxygen availability, particularly with respect to hospital beds, admissions, and all that. For that, again, a different kind of a strategy has to be adopted, and we had to contact certain hospitals. We had to contact certain, other groups, because these are costly affairs, and we cannot really do something like that. So first and foremost thing was the arrangement of oxygen concentrators. So there was one organization in our Jain community called JITO, Jain International Trade Organization. They arranged with the Bharati Jain Sangathan around 100 oxygen concentrator in Bangalore. and that 100 oxygen concentrators were distributed all across Bangalore for different people to take care of their areas and give it to the needy people who were looking for that. So this was one initiative we took. Apart from that, from our Jain community side, we set up COVID care centers, which was in Kingeri town, Kingeri suburban area, which was part of one hospital, and that tie-upping of that hospital, we created one 200-bed COVID care center. We also set up quarantine centers for travelers and visitors, which was almost free of cost to most of the people, except for the food cost, which was there. Then we also did one creation of online consultation panel of our Jain doctors and all that, so that people can consult with them, particularly during the second pandemic wave. It was very much required because there were every day a lot of big cases were coming in. Even doctors were not available for consultation, and we had to create all over India. Of course, these even whatever we say about the WhatsApp and WhatsApp University and all, but you also know that these social media platforms and the apps were very useful in giving this online consultation and these help informations to all the needy people during that time. And one more thing is that we also did is that we approached our saints, our munis, and our holy people who were having much wider influence over the society, and we requested them to give the directions to our people so that they can follow what could be the appropriate behavior, even after opening of the lockdown, easing of the lockdown, when they visit the holy the temples or any other places, or when they go for prayers and all that, or during the lockdown period, they were thinking how to go to temple and all. So we had to do all that kind of thing. So they appeal to our people that please don't go to temples, please don't come in groups, or please refrain from visiting such kind of places. Whatever puja and everything you have to do, you can do prayers at your home. All those kind of things will help a lot and all that. At the last, when the things got normalized during the opening time and all that, we ensured that even if the temples are opened, even if the pujas are allowed, even if the things can be normalized in a way where people can go to their places everyday basis, we ensured that people are wearing the mask and they are coming in slot wise basis. I mean, we were giving them time that if you want to visit, just book in the seat, Google Sheets and all that. And we were giving them slots for puja, we were giving them slots for darshans and all that. So they were coming in that time, and we were giving them certain timelines that you have to come in this much time and go in this much time. And we were ensuring that everybody is wearing masks. We were checking their temperatures. We were checking their facial this thing also. And apart from that, we were giving them soap and water so that they can wash their hands before touching anything inside. Or most of the things were not allowed to touch, but still people can touch anything inside, which is very difficult to prevent. So we were making sure that they wash their hands before entering into our temples and all that. So eventually all this led to that we were by and large got very few number of cases from our community side, and that helped a lot. And whosoever got it, we ensured that they got proper treatment and also that they don't go into a very serious situation. And all this helped a lot. Apart from the usual things which we do during these kind of things, is that the prayer to the God that everything becomes all right, nobody get sufferings from this kind of pandemic. Of course, these are prayers only, which cannot do anything on you can see through the eyes, but yeah, we know that there are a lot of powers in the prayers. So these also helped into make the people feel better and at least relieve them from getting tensed in this kind of situation. And this helped a lot in our community. Hope these kind of things has helped in other community as well. Thank you very much for providing this opportunity to me to give the words which we did. Thank you.
Thank you so much, sir. Thanks a lot. And thank you for all your remarkable work to the society. Now we are going beyond the time, actually. Now let's move to the second question. The second question is, what opportunities do you see in the future to address challenges? And let me repeat the question. What opportunities do you see in the future to address challenges that you can foresee in the context of the present situation? Now I request our panelists to speak on this, but please make sure to keep your responses for 2 to 3 minutes because we are running out of the time. So now I call upon His Grace Swayam Prakash Dasji to speak on this question.
Thank you very much, madam, for this. So, yeah, it is a really very good eye-opener in one sense, that although we have heard from our parents and grandparents right from the childhood that keep cleanliness, they would emphasize and all the things, but still, many times as a youngster, I myself, I might have done that many times, that not taking those things seriously. But this taught a lot of lessons for our own life, that how, although it is a small thing, it plays a major role. So one thing from our side, what we foreseeing, what we had to undergo at present, and what in case we hope and pray that the third wave doesn't come. But even if it comes, we need to be prepared for it. So with that, what we did is in all our centers, especially in Karnataka as well as India, in all the centers where there are centers, either small or big, we established a community kitchen. Like even maybe in Bangalore itself, we have almost 7-8 centers. Apart from that, in the Surathkal or Dharwad, Hubli, Belgaum, in all the places we established a sophisticated community kitchen wherein, according to their capacity, they can cook and try to feed the people in need. This is one thing which we took the action. And second thing is that the focusing on the vaccination. At least in our center, everybody is double vaccinated as of now. All the volunteers and who are serving in our center in South Bengaluru, as well as we made sure that to inspire whoever are above the age group and whoever can go and take the vaccination. So that one thing is prevention. Just like when you go to the doctor, they tell the prescription and also the prohibition. So one thing is like taking vaccination and also taking the preventive measures, making sure what the government gives the order to follow them. Along with that, one thing is on one side vaccination, but apart from that, on a longer run, we need to see, and then that way we thought of having wellness courses which will give them the mental support, because we see, I came across many of my own friends or little known people who, when the situation happened, it was quite tough time to handle. So that one thing we are focusing on. And also that another focus which came to all of our temples is the self-sufficiency. Because when this sudden situation came, for the basic things, even just a simple thing like in the temple, we offer flowers. But at that time, we could not get flowers. So that gave us a thought of, okay, how to, in case if such situations come, what can we do? How can we have in the outskirts of the city limits, how can we have in our own small land, we can grow the flowers or the vegetables, whatever is needed. So that can help. And that way it gave us an opportunity to start a terrace gardening. We started terrace gardening in the last May and try to grow some things which can come up in the vegetables or the flowers that we focused. And that way we are trying to make it a habit of having a regular farming communities, because our Srila Prabhupada, founder, also tell simple living, high thinking. That way make things self-sufficient so that we need not have to depend much on the others. So this we are trying to focus it, bring it at the level of the country level, as our Pradhan Mantri ji is also making an abhiyan of bringing this concept of previously the mask we were importing, but Pradhan Mantri brought it that let us make it, and so many people started it, that we want to focus it on the country level, and at the organization level we are focusing, and at the same time individual level also we want. Along with that, we want to bring in the organic and healthy lifestyle, so that as many of the doctors, even in the beginning also, UNICEF also, from them also, we heard that how it's important to have good resistance capacity. When you have resistance, then no matter what outside things are there, it becomes easy to deal with it. So for that, what we need is a healthy lifestyle and organic. So we are focusing on all these things. So these are few measures which we want to take it. And one thing which, like many things I got to learn from others, so it was very wonderful. Thank you. Thank you very much. Hare Krishna.
Thank you, Guruji. Yes, cleanliness is godliness, rightly said, and the people in our surroundings, we try to donate here, there, and there. I'm not saying it's something wrong, but we have to think about the people, those who are surrounding us. So we have to feed the people, those who are in need within our surroundings also. And we have to follow the protocol. Thank you, Guruji, for sharing all these things, and all the best for this future plan. And now I invite our respected Maulana Saab Zoheb Khan ji. Sir, welcome, sir.
Thank you so much, ma'am, for inviting again. Regarding the precautions and the ongoing things that we can be doing now to prevent this pandemic is, yes, of course, vaccination is very important, which we are conducting various camps. And the turnout, if we compare to earlier, before September 1st and now, the turnout has become very, very less. In fact, now what we are doing is we are teaming up with the BBMP, the local authorities from the government. And advantage is that since we have a hospital, we have a team of nurses and doctors, we are going door to door and we are conducting camps in thickly populated areas and creating this awareness of vaccination and vaccinating people as well. Because we have seen that vaccination is helping people, and it is also one of the major points wherein we can help defeat COVID pandemic. So this is one thing that we are working on. Apart from that, what we are actually looking at and what we actually need as support from different organizations, since we have leaders of different faiths here. Now that we have collaborated within the community and we have done stuff which we have done in the first pandemic and the second pandemic as well. But now that we are people of different faiths, leaders of different faiths are present here, we have to collaborate now. We have to get together as a team. And if we can help people get back to their jobs and create that jobs for them and help set up petty businesses, help clear their rents, their advances are being closed, they do not have houses, because we're getting a lot of cases. For example, if you take from the education perspective, there are from, especially anything that I'm talking is from the lower section of the society, wherein they are unable to pay their fees. Now what's happened is the fee for the last academic year is pending, and they are unable to join online classes and the physical classes now because the previous year fee is pending, and the current fee they are unable to pay because they have to take care of their house expenses. And God forbid, if they have any medical issues at home, then that is an added thing for them, and they are unable to concentrate on education, due to which we have a lot of dropouts. And good students who are intelligent, who have certain skills in them, they are unable to continue their education because of lack of finances. So we as a team, we as people, leaders of different faiths, if we can join hands together, understand how we can help the society get back to that normalcy and how we can see the nation growing now, is we have to join hands. As a community, yes, we have done that and we are continuing to do that, and that's a great thing. But the greatest thing will be that if we can join hands for people of different faiths, so if we can work on that, setting up petty businesses as well, and also that clearing their house rents, house advances are this thing. So creating jobs and
dropouts. If we can work on these things, especially at this point in time, I think it is very important that we join as a team here. And I request the organizers, and we have different organizations who are partnering for this event. If we can have another meeting or so, maybe offline, we can get together at a different place or whatever, as everybody decides. If we can work on this, I think that will be a great thing, especially now that the second wave has subsided and third wave was anticipated, but with the prayers or with the social distancing and whatever vaccination and awareness that we are doing, due to which the third wave, I don't think in the near future is what we are expecting. There are experts who can talk on this, but however, if we can work on this, I think it will be a great thing. Request the organizers to take heed on this, make a note, and I am ready to give my 24/7 for this. And from the organization and from the Muslim community, yes, we are ready. Whatever we can do together for the development of the nation, we are in together. Thank you so much.
Thank you, sir. Thanks a lot. Yes, during these two waves, many of them, they lost their livelihood, and especially the daily wage earners. So we really appreciate your thought that like all faith leaders will come together and support the people and creating the jobs like petty business, all those things. Thanks a lot for your thoughts, sir. All the best for your future plans. And now I invite our beloved Father George on this question. The question is, what opportunities do you see in the future to address challenges that you can foresee in the context of the present situation? Over to you, Father. We'd like to hear from you.
Well, I think that we should probably focus on three areas. Is the aspect of poverty, and as we know, globally, about 18 million people have been added to the list of the hungry people in the world because of COVID. This is in addition to the existing number of about 680 million people even otherwise. So we know that a large number of people have been now affected with unemployment. A lot of people are still not able to get back to their work. So I think it's a very, very important responsibility for all of us to ensure that there is food on every table in every family. So a concerted effort at hunger alleviation, I think, is a primary responsibility for all of us. I know that ISKCON and various other organizations are playing a major role already. So can we all come together and create a kind of a consortium that will deal with this issue in every major city, at least in the country? Well, that would be one area that we can look at. And this is where programs like Mother's Meal can also be of great help. Number two, I think, is the area of developing infrastructure. We are not sure about the third wave, but even if it doesn't come, doesn't matter. Well, various disasters, health disasters are coming up, and so I think this time must be utilized to improve our health infrastructure in terms of buildings and equipments and personnel, training people. So whatever health disasters come, we are able to deal with that. A third area is, of course, as already mentioned here, is about dealing with children. We have a large number of them who would have lost maybe both parents or single parents. And many of them now dropped out of the school system because not able to go back to the school on the one side, and because of economic problems, not able to rejoin the school, not able to pay the school fees, etc. So what are these children going to do? So we're going to find probably more and more of non-school going children, probably more of street boys and street girls, maybe increase in the number of children in conflict with law. So I think we need to be really prepared for dealing with the situation the children find themselves in for no fault of theirs. So lastly, if all of us could probably network together and come out with some strategies to deal with these three areas, I would be very glad about that. Thank you.
Thank you, Father. all the best for your future plans. And now I invite Guru Rakesh Breya to elaborate on any support mechanisms or platforms provided for awareness, vaccination, follow-up actions, etc. Welcome you, sir.
Thank you, Suvaji. The eminent panelist has already spoken a lot about coordinating and collaborating with each other. I just wanted to add up here is that, third wave may not or may be coming, we don't know. But yes, immediate need of the hour is to make everybody get vaccinated. And for that, community, awareness is very much important. We are already doing that in our this thing. We are having our community, which is one of the most educated community in India. So most of the people in our community are already aware about what are the benefits of vaccination and all that. But still, we need to drive them to, take the vaccine shots as early as possible whenever they get the opportunity. And that is what we are creating awareness to them. And we have been very successful in getting them, taking the vaccine shots, and most of them are having almost done for their first shot at least, and second shot is whenever they are getting due, they are going for that. So vaccination is one thing which can help us to get the things sorted out, at least to this thing extent. Regarding the job lost or the food requirement of the people because they don't have anything to eat, this is something which is a very big issue, which is definitely has to be addressed. But collaborating only with a small section of leaders like us may not be helping to a very big number of people. Of course, we can collaborate and do something in our own community, or maybe to certain people. We are already doing to certain people through our smaller efforts, which we could do by gathering money among us, or by calling for the donations from other people whosoever are there. But that may be a few hundreds people, that's it, nothing more than that. But this problem is running in few lakhs, or in few crores, which we really are difficult to manage that. So if something can be done about as a big collaboration, then it would be definitely helpful. But we are sure that if things become normal by with proper vaccination, and we keep on properly following the proper behavior in terms of pandemic prevention, then things might be during the next 6 months to 1 year time, people will be able to get back to what they have already lost in this kind of time. So we are very hopeful on that, but still we look forward for any collaboration or anything which can help us to get this over. Thank you.
Thank you very much, sir. And now we are beyond our time, actually running behind our time. So now it's question and answer session. I'd like to invite Mr. Manu Sebastian. Over to you, Manu Sebastian.
Thank you for the wonderful presentation. I thank all the panelists for doing such a great work. As part of UNICEF support to the government of Karnataka, we are doing what Dr. Salima told already. So for any support working with the government and implementation, we also are working with many partners across Karnataka, and we also are working with media and other groups. So if you want any support, I have already mentioned my number. I want Ms. Ritika's support, if any, I don't think any questions is there. If any of the participants here want to ask any questions, you can go ahead with whatever language is there, Kannada or English, Hindi. I think panelist would be willing to answer. ಏನಾದರೂ ಪ್ರಶ್ನೆಗಳಿದ್ರೆ ನೀವು ದಯವಿಟ್ಟು ಕನ್ನಡದಲ್ಲಿ ತಪ್ಪಿದ್ರೆ ಹಿಂದಿಯಲ್ಲಿ, ಕನ್ನಡದಲ್ಲಿ ಮತ್ತು ಇಂಗ್ಲಿಷಲ್ಲಿ ಕೇಳ್ಬೋದು. ನನ್ಗನ್ಸ್ತದೆ ಇಲ್ಲಿರುವಂತ ಮುಖ್ಯಸ್ಥರುಗಳೆಲ್ಲ ಅದಕ್ಕೆ ಉತ್ತರ ಮಾಡೋದಕ್ಕೆ ರೆಡಿ ಇರ್ತಾರೆ. Ritika, any questions through the live streaming?
So Manoj, I would just request you to just concise it in few sentences in Kannada as to the discussions that have been held. I am asking for the questions in chat as well.
Okay. ಓಕೆ, ಇನ್ನು ಏನಾದರೂ ಪ್ರಶ್ನೆಗಳಿದ್ರೆ ದಯವಿಟ್ಟು ಚಾಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲೂ ಹಾಕ್ಬೋದು, ನೀವು ಚಾಟ್ ಮಾಡ್ಬೋದು. ಇಲ್ಲಿ ಮುಖ್ಯವಾಗಿ ಇವತ್ತು ಚರ್ಚೆ ಮಾಡಿರುವಂತ ವಿಷಯ ನಿಮ್ಗೆಲ್ರಿಗೂ ಗೊತ್ತಿರುವಂಗೆ ವಿವಿಧ ಧಾರ್ಮಿಕ ಸಮುದಾಯದ ಮುಖಂಡರುಗಳು ಅವರ ಸಂಸ್ಥೆಗಳ ಮೂಲಕ ಯಾವ್ದು ಕೆಲಸಗಳನ್ನ ಕೋವಿಡ್ ಸಂದರ್ಭದಲ್ಲಿ ಮತ್ತು ಕೋವಿಡ್ ನಂತರದ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ಎರಡೂ ವೇವ್ ನಡೆದಂತ ಸಂದರ್ಭದಲ್ಲಿ ಮಾಡಿದಂತ ಕೆಲಸ ಕಾರ್ಯಗಳನ್ನ ಆಯಾ ಸಂಸ್ಥೆಗಳು ತಪ್ಪಿದ್ರು ಧಾರ್ಮಿಕ ಸಂಸ್ಥೆಗಳ ಮೂಲಕ ಮಾಡಿರೋದನ್ನ ಚರ್ಚೆ ಮಾಡಿದ್ರು. ಸಾಕಷ್ಟು ವಿಷಯಗಳು ಎಲ್ಲಾ ಸಮುದಾಯದ ಮುಖಂಡರುಗಳು ಈ ಒಂದು ಕಷ್ಟದ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ಜನ ಸಮುದಾಯಗಳಿಗೆ ಅವರ ಜಾತಿ ಧರ್ಮ ಪಂಥಗಳನ್ನು ನೋಡದೆ ಸಹಾಯ ಮಾಡಿದ ಬಗ್ಗೆ ಸಾಕಷ್ಟು ಚರ್ಚೆಗಳು, ಅಭಿಪ್ರಾಯಗಳನ್ನ ಇಲ್ಲದ್ರೆ ಅವರ ಕಾಣಿಕೆಗಳನ್ನ ಹಂಚ್ಕೊಂಡಿದ್ದಾರೆ. ಹಾಗಾಗಿ ನಮ್ಗೆಲ್ಲ ತುಂಬಾ ಸಂತೋಷ. ಸಾಕಷ್ಟು ಈ ತರದ ಕೆಲಸಗಳು ನಮ್ಮ ರಾಜ್ಯದಲ್ಲಿ ನಮ್ಮ ಸುತ್ತಮುತ್ತಲು ನಡೀತಾ ಇರುವಂತದ್ದು ನಾವು ಹೆಚ್ಚು ಜನಗಳಿಗೆ ತಿಳಿಸುವಂತ ಅವಶ್ಯಕತೆ ಇದೆ ಅಂತನೂ ನನಗೆ ಅನಿಸ್ತದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲೂ ನಿಮ್ಮ ಯೋಜನೆಗಳನ್ನ ಕೇಳಿದ್ರೆ ಸಾಕಷ್ಟು ತುಂಬಾ ನಮ್ಗಂತೂ ಸಂತೋಷ ಆಗುತ್ತೆ. ದೊಡ್ಡ ದೊಡ್ಡ ಯೋಜನೆಗಳನ್ನ ಸಂಸ್ಥೆಗಳು, ಸಮುದಾಯದ ಮುಖಂಡರುಗಳು, ಧಾರ್ಮಿಕ ಮುಖಂಡರುಗಳು ಮಾಡ್ತಾ ಇರುವಂತದ್ದು ನಮ್ಗೆ ತುಂಬಾ ಸಂತೋಷ. ಜೊತೆಗೆ ಎಲ್ಲ ಮುಖಂಡರುಗಳು ಹೇಳ್ದಂಗೆ ಎಲ್ಲ ಇನ್ನು ಇದನ್ನ ಮುಂದುವರಿಸ್ತಾ ನಮ್ಮ ಹಂತದಲ್ಲಿ ಕರ್ನಾಟಕದಲ್ಲಿ ಇಲ್ಲ ಬೆಂಗಳೂರಲ್ಲಿ ನಾವೆಲ್ಲ ಸೇರ್ಕೊಂಡು ಸಭೆಗಳನ್ನ ಮಾಡಿ ಈ ಒಂದು ಏನು ನಾವು ಎಲ್ಲರೂ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಅದನ್ನ ಒಟ್ಟುಗೂಡಿಸಿ ಒಂದು ದೊಡ್ಡ ಕಾರ್ಯಕ್ರಮದ ರೂಪದಲ್ಲಿ ಮಾಡೋದಕ್ಕೆ ಸಾಧ್ಯವಾಗ್ಬೋದಾ ಅನ್ನುವಂತ ಅಭಿಪ್ರಾಯವನ್ನ ಕೆಲವರು ತಮ್ಮ ಇಚ್ಛೆಯನ್ನ ವ್ಯಕ್ತಪಡಿಸಿದ್ದಾರೆ. ನಾವು ನಿಮ್ ಜೊತೆ ಇರ್ತೇವೆ. UNICEF ಇಂದ ನಾವು ಬೇಕಾದ್ರೆ ಅದನ್ನ ಫೆಸಿಲಿಟೇಟ್ ಮಾಡೋದಕ್ಕೆ ನಾವು ಮುಂದೆ ಬರ್ತೇವೆ. ನೀವುಗಳು ಆಸಕ್ತಿ, ನನ್ನ ನಂಬರ್ ಅನ್ನ ಕೊಟ್ಟಿದ್ದೇನೆ, ನೀವೊಂದು ನನಗೆ ನಿಮ್ಮ ನಂಬರ್ ಅನ್ನ ಮೆಸೇಜ್ ಮಾಡಿದ್ರೆ ನಾನು ಅದರ ವ್ಯವಸ್ಥೆ ನಾನು ಮಾಡಬಹುದು. ಜೊತೆಗೆ ಸ್ಪಿಯರ್ ಸಂಸ್ಥೆನು ಅವರ ಉದ್ದೇಶಗಳು ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂಗೆ ಅವರನ್ನು ವ್ಯಕ್ತಪಡಿಸಬಹುದು ಅಂತ ಅನ್ಕೋತೇನೆ. ಏನೇ ಬೆಂಬಲಕ್ಕೋಸ್ಕರ ನೀವು ನನಗೆ ಮೆಸೇಜ್ ಮಾಡಬಹುದು. ವಾಟ್ ಯು ಐ ಜಸ್ಟ್ ಟೋಲ್ಡ್ ಕನ್ಸೈಸ್ಲಿ ಇನ್ Kannada, Ritika. So any support, I think from UNICEF side, I will be willing to coordinate. So what do you, Ritika?
Thank you, Mr. Sebastian. I would just like to ask all my panelists about one thing that I did see that ESCON had touched on. I would like to put this question forward for other panelists as well. We have seen that mental health is a very important part of our day-to-day life now, since we are all in confined spaces. I wanted to know from other faith leaders as to what are the steps as faith leaders are you taking, sirs, for betterment of your people's mental health? Rakesh sir, if you would like to answer the question.
Well, this is something very interesting and very difficult to answer, because mental health is something which you cannot gauge actually. People also do not come forward for any such kind of thing. As I mentioned in my discussion is that that we normally take help of our gurus and our saints for these kind of matters actually. this is where their advice, their appeal to the people for doing something or calm down or take care of their health, or maybe all those kind of things, helps a lot people to overcome that crisis actually, because the situation are not in their hand actually. It is something which is happening around, and really they cannot do much about it except for taking care of their safety as well as health. But if situation happens that you cannot prevent it from coming to you, then you have to take care of it. So a lot of people got depressed looking at the situation during the second pandemic, this thing, and that is where we had to take care of this kind of thing by taking advice from our gurus, and they really helped us a lot by giving this kind of suggestions to the people that please do not get panicky. Please make sure that you are following the norms and the doctor's consultations, whatever has been given to you, or whatever precautions you have to take care. That helped a lot to calm down. Of course, apart from that, we make the people to get themselves offering to themselves to the God by doing their prayers, chants, and doing their mantra jap and all that. That also helped them a lot. But we have not done as such too much this thing about mental health, because this is something which very, very difficult to gauge and get over this. But I am sure that these things has helped a lot, and we have not come across anybody among us, at least, who has not been able to come out of the situation which they had.
Thank you. Thank you, sir. I do see Mr. Shri Zohib Khan's sir's hand up. Would you like to respond to this, sir, or do you have a question of your own?
Yes, ma'am. There are 2 points that I wanted to put across the panelists here. One is, while we are parallelly working on setting up things for people, getting things to normalcy by providing them that financial support, the mental support that you also spoke on. Yes, that is very important, because what I think is currently the situation at the grassroots level, especially from the lower section of the society, is that if we have to work on their mental stability, we have to work towards their daily expenses and provide them that support so that they can move on in life. If that can be done, I think majority of the mental stability will be taken care of. That's my perspective, being at the grassroots level. That's one. Second thing is, while we are working on this parallelly, can we also prepare for the third wave? God forbid it doesn't come again, and we do not want to be in the situation that we were in the past waves. But parallelly, I think we should be prepared as well, because the second wave was pathetic. Being at the grassroots level, being on the field, what I felt was, for example, if there were 100 deaths, I think 80 could have been easily avoided had we had that appropriate amount of infrastructure, the right resourcing being done. If that would have been done, I think 80% we could have saved lives. 20%, yes, it was a pandemic. Immunity was a challenge, and people had to succumb, and that would have happened. But that 80% was controllable, which was within our hands, because had we had that enough beds, those oxygen and those hospitals being available and all those available at the time, just getting into during that time, the government can prepare for whatever necessity things that are required. Unfortunately, that didn't happen, and we saw a lot of deaths happening, more so because of lack of resources. So all the fake leaders are present here. Can we also parallelly think on what are the necessary steps that we have to be ready with for the third wave, God forbid if it comes again. So those are the 2 points that I wanted to put across.
Thank you, Mr. Khan. I also see His Highness Prakash Das Ji's hand raised. Do you have a question, sir? Would you like to answer this one?
I have a question, as well as now I had just a request to make. That one question is that, as we heard from Shri Manu Sebastian sir, that UNICEF is ready to help provide the support to all the organizations or in whatever way want. I want to know what kind of supports we can get from the UNICEF. ಯಾವ ರೀತಿ ಸಪೋರ್ಟ್ ನಮಗೆ ಸಿಗಬಹುದು ಇದರ ಬಗ್ಗೆ ನೀವು ಸ್ವಲ್ಪ ಹೇಳಿದ್ರೆ ನಮಗೆ ಅದರಲ್ಲಿ ಮತ್ತೆ ನಾವು ಯಾವ ರೀತಿ ಅದನ್ನ ತಗೊಂಡು ಮುಂದಕ್ಕೆ ತಗೊಂಡು ಹೋಗುತ್ತೆ ಅದು ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಅದೇ ತರ ಅದೇ ಅಲಾಂಗ್ ವಿತ್ ದಟ್ ಐ ವಾಂಟ್ ಟು ರಿಕ್ವೆಸ್ಟ್ whoever is the representative from Spear India to share that this you organize this wonderful stage wherein different community people could come. So how is that the Spear India can help in the time to come in such situations? If you can address this question, because I was just reading one book called it was written by Richard Slavin. He comes from Chicago in search of spirituality. He comes to India. He has written a book called Journey Home. In that he writes that when he came to India, in one of the places in the North India, he came across two people. One was Hindu and one was Muslim. And they both were very close friends. Every day they would meet and they would discuss. He would share from Bhagavad Gita, the other would share from Quran, and they were very close. And this was happening in 1970s, wherein he writes that when there was big tussle happening within the countries, they were very close. I went and I was talking to him, he would interact with them. Then they said that actually the God comes in different forms. That only thing is which we have to see. Just like if a dog comes to the master, whether the master is wearing a tuxedo or he's in a pajama or in a night dress or he's naked, it will identify its master. The same way they said that if we cannot identify our master, who is the same person may come in different forms of this one, then we are no better than the dogs. So I just remembered when all of us were sitting and ready to put hands together to support in the time of the need. So if both of you can answer, Mr. Manoj sir as well as whoever is from Spear India, it will be very helpful. Thank you.
Yeah, thank you, Swamiji, for that question, and also Mullah sir for the question. As I said earlier, we actually work with the government, supporting the government in implementing the risk communication and community engagement activities across India. We support Government of India and also Government of Karnataka. Presently, we do a lot of communication materials, and we also work on resistance for vaccination right now. Other than during the first wave and second wave, whatever you all were doing, we were also doing with our partners. We have quite a few partners in all the states, NGO partners, and also religious institutions. We have also already trained the volunteers of Art of Living, Sri Satya Sai Sevashrama, and JSS Mutt, and also the Archbishop and Diocese of Bangalore. So we do a lot of activities like this. We also train people, the health department staff, on lots of technical and non-technical skills. We also train them on communication skills. For example, we train them on IPC, how to conduct an IPC to motivate a resistant person. So we are training on all these things. We also are working in less privileged areas of Bangalore and major cities with the domestic workers, auto drivers, street vendors, okay, people with disability, to motivate them for vaccination and provide whatever government services are there through various partners. We also work with private medical institutions. We also technically support on the mental health issues that you are talking. There is an helpline set up by Government of India and Government of Karnataka with the support of NIMAX. These mental health issues require some sort of technical competencies to respond. So there are a lot of calls for our helpline that is coming. So mental health issues, I think it depends. It is always good that experts take care of it. Other services, I think we all can do. So as part of support, I already told that we can facilitate and coordinate for the meetings within you all. We can conduct a meeting very soon if you all wish to. Kindly message me your number so that I can be in touch and conduct that meeting. We can also work with all of you, including Spear India, to organize this. We don't want to do it our own initiative, but we all together we can do it. So we can also train your staffs or volunteers, devotees on various COVID and IPC skills that is required to support each other, support our neighbor. As Father said, family to family support. We can also support each other devotees. So there are a lot of things that we can generally do. See, we are facing challenges to follow the CAP, COVID appropriate behavior in our communities, so that all our devotees, volunteers of various sects can promote these activities, these behaviors, so that we all are safe. I think there are a lot of issues that we did a survey recently, and only 30% of them said that it is very compulsory to wear a mask after vaccination also. So these are the messages that need to reach the community, each one of our community. We have a society where all are not privileged as we are, so that I think there are a lot of less privileged areas and people who are not able to make follow all the precautions or what government is saying all the time. So there are a lot of challenges in adopting to it or to our regular behaviors. So we all can work on these issues. We can actually train all of you on that also if required. So there was question to Spear also, Ritika or Altmash
Thank
Khan.
you, Mr. Sebastian. I'll take the question. Sir, I would like to speak about Spare India. Spare India is a coalition of different humanitarian bodies, out of which faith-based organizations are also part of it. Many of them are faith-based organizations. We work with these faith-based organizations and do different activities, whether it is training, whether it is joint rapid need assessment during a disaster, whether it is sending relief, or it is about a rehabilitation. We do that with these faith-based organizations, or if it is about data collection after disaster. So we do all of this together with the faith-based organizations. We also invite other faith-based organizations to join Sphere India as a member so that they can be part of this effort as well.
Okay, just a short this one that in the second COVID, when the second wave came, actually one of the problem we faced was that with the limited capacity we have at different centers. If I speak about my own center, there we had the capacity to cook more, but we are falling short of two things. One is the funds. Whatever funds we are getting, we are falling short of the funds. And second thing, some of the volunteers who has to go and give it at the place where it is needed. We took help of two organizations, NGOs, they came forward, but still we had the capacity to cook and all. But our team, if we go out, then we cannot cook. If we cook and pack, then we don't have the bandwidth to go and reach it to the people who are in need. At the same time, we have the capacity, but we are falling short of the funds. Is there any way the Sphere India can help in this regard? Because there are many people who may be in touch with people who are ready to fund or CSR funds, that if it comes or in any ways, then joining the hands that can be worked
out. I'd like to take that question, Ritika. Hello, sir. I'm Jennifer Kishan. I'm actually the program manager from Sphere India.
Thank you.
So yeah, in terms of funding opportunities, it's not like we do any direct funding, so to say, but we work with, interagency groups in different states where, different faith organizations are part of these as well. During such times, especially in COVID response, we have done a lot of work during the second wave. So in terms of training and capacity building, as Ritika was just mentioning, or providing advocacy support, or providing interagency coordination at the state and district levels, we are very much, we are primarily, we're a coordinating agency. We don't have we're not a donor agency or that sort of role.
No, I'm not
So-
asking you're donating from yourself. You may be in touch with like
raising
people.
funds, right? So in terms of raising funds, I think basically we have a lot of organizations who are part of our coalition, and what we do is we sort of advocate around their emerging needs that are coming out of these disaster emergencies. In this case, it's a health pandemic, so we talk about what is required and what sort of capacity. In that, if it externally generates funds, or for instance, our donor partners might want to respond in a different way, that would be a separate issue. But like directly, I don't think we do that. However, again, we also have a good network of faith-based organizations at the moment, and faith leaders who we have interacted through this interfaith humanitarian alliance. We would really appreciate it if you are all in touch with us and associated with us, because as while we say that a third wave is might not happen altogether, but there's there's a possibility of it, obviously, in the longer run. With the pandemic, we have seen that happen. So it would be really nice if you could all be in touch with us and associated with us. As Mr. Manoj was saying, this also means, in terms of them, reaching out in terms of their capacity building activities, which UNICEF is very wonderful at, in fact. And they run a lot more interfaith programs, not just in India, but abroad as well. So I think it would be a very good thing if we can associate beyond just this one session over here. And, in the long run, we might be able to help you out and you us in so many ways. Thank you.
So I think there
are no questions further. Altamash, I would request you to kindly give vote of thanks.
So I want to thank everybody for participating, including all the panelists in making the session successful. There were so many of great insights during different rounds of discussion. I also appreciate the idea of collaboration of faith leaders for creating livelihood opportunity for people and to create awareness among the community. Thanks to Shobhaji from World Vision India for moderating the session, and Dr. Salima Bhatia from UNICEF for the keynote address, Mr. Manoj for moderating the interpretation. Thanks to our colleague from Spare India, Jennifer Kishan and Ritika Tiwari for all the background works in successfully organizing this session. We look forward to be associated for a long run in future as well, as we are discussing just now. So now we would like to end the session. Thank you so much, everyone, again. We'll meet again. Sure. Thank you.
Thank you. Hare Krishna.
Thank you very much. Thank you.
Thank
Thank you,
you.
everyone.
Thank you all. Thank you so much.
Thank you all for the session. Thank you very much.
Thank you all the faith leaders as well to giving us their very precious time. Thank you so much.